present the 17th Annual Randall M. Award of Excellence. This award was created in honor of my late husband, Randy Dana. The award honors a dedicated staff member who has shown a commitment to ADAMH, its system of care, its consumers, and family members. Anyone in here who might have known my husband knows that he was a very passionate and compassionate man. He dedicated his entire life, actually, to serving people. He was not only just a Cub Scout, he was an Eagle Scout. He joined the military and then stayed for 17 years in the Army, in the National Guard, in the Selective Service. He not only joined AA at one point in his life, he became involved with the Governor's Council on Alcoholism and became very active in the ADAMH board. And probably everyone in this room will agree one of the wonderful things he did was be on the search committee for David Royer. Way back when. So his compassion was wonderful. He brought in stray dogs, he brought in stray people. He had clients live with us. He was the director of the Ohio Public Defender system in Ohio. He just did a lot trying to help people throughout his life. So I'm very honored to stand here and be able to give this award in his name. This year's recipient is William Burton, manager of the Outcomes and Community Engagement at the Maryhaven Addiction Stabilization Center. William has devoted his entire working life, as well as much of his personal life, to helping the substance-using population. After regular work hours, William volunteers at Safe Point and leads Narcan trainings at different organizations in Franklin County. At these trainings, he inspires individuals to remain hopeful and to stay committed to the cause of fighting substance use disorder. William volunteers at local nursing schools to educate and provide insight to students about the field of addiction treatment. He is constantly at work to shift individuals' perception of addiction through education, rooted in research and his own personal experience. Without William's advocacy in the communities of Marion Village and German Village, the Maryhaven Addiction Stabilization Center, which serviced over 3,000 individuals in its 20 months of operation, might not have opened. His ability to promote cooperation among the communities and advocate for the necessity of the Addiction Stabilization Center was a significant factor in its launch. William continues to be an advocate for the recovery, being a contributing member of the Harm Reduction Subcommittee, a frequent panelist at seminars held by the Columbus Police Department and the Columbus Fire Department, and always taking time to promote the well-being of individuals at the Stabilization Center, employees and patients alike. William maintains the center's relationship with the Columbus Fire Department, one of its largest referring partners. He spearheaded Maryhaven's efforts during Franklin County's Walk-In for Recovery, spending countless hours preparing for the event and representing Maryhaven at the John Maloney Center, including 12-hour days on site in the hopes of making a difference for an individual. William also created the Compassion, Patience, and Respect program, CPR, at the Addiction Stabilization Center. He continues to lead the discussion and recognition of individuals at the center who demonstrate growth in these areas. William was nominated for this award by Emmanuel Delaveris, who said, "Through all that William does, he remains humble, and his only aim is to further treatment of substance abusing individuals. He only cares to continue the conversations surrounding addiction while simultaneously working to reduce the stigma that comes along with it." It is for these reasons that William embodies all of the Randall M. Dana Award of Excellence signifies. I'm honored to recognize William tonight. I think Randy would agree that he is the definition of an advocate and champion in the field of substance use treatment. Please join me in congratulating the 2019
It's a lot to handle. I feel like baby giraffe, like trying to drink. That's my stock microphone joke. In the beginning, when I was talking with Amy, she came up and she said, "You don't have to say anything if you don't want." I said, "Oh no, I've got a type 5 that I've been working on material, so I think this is as good a place as any to try that out right now." So my name is in the program and it's on this award, but truly this is a team award. I consider myself very fortunate to have the opportunity to work with the patient population that I do, and to work at the facility that I do. We truly believe that recovery is not for those who can afford it. We don't turn anyone away based on ability to pay. And that's a point of pride for me, and that helps me to continue the work that I try and do. If anyone spends any time with me during the day, you often hear that I feel that really what any of us want or hope for is to be seen. I think at the end of the day, everyone in the room, everyone that we work with just wants to feel seen, and wants to have their dignity upheld. I can say in this moment, thanks to the team that I work with, especially Nate, Crystal, Manny, and Andrew for taking the time to nominate me. Because of them, I feel incredibly seen right now and empowered. Hopefully everyone in this room will think about what they can do on the daily to make sure that they feel, or that they can empower rather, and help all of our patients and clients feel seen. And I think if we do that, we will all be better for it. I always say that I don't think it's pie in the sky to believe that change can happen through conversation. I am a believer in that, and so I hope that we all take the time to talk to each other about hard subjects, addiction, stigma, treatment. Take the time to talk to each other and not type at each other, and if we do that, I think we can really impact real change. Thank you to ADAMH for choosing me for this, and again, thank you to the team, and also the teams that have been honored tonight. Quarterback, QB1, Chief Med Pace, and then the full-on React teams. We had a quarterback, the football team, and I guess that makes me like the analytics guy. Right? I accept that. That's okay. So thank you to all of our partners in the room that we work with, and again, I appreciate just having the opportunity to hold this award with my name on it. This is to everyone in the room that is living proof that recovery happens, and this is also to my mom for also showing that recovery happens.